All right, good afternoon, everybody. And thank you very much for joining myself and the ACSA to this info session on OHS code changes with the Government of Alberta. It was a very popular topic when we had this set out about a week and a half ago. So thank you very much on taking the time out of your day to listen to what these fine individuals have to say about OHS changes and what's coming up here very, very shortly. So who I have here today is Paula Elliott. She has started with the Government of Alberta as an occupational health and safety officer 12 years ago and has held various OHS roles in that time. In 2019, Paula obtained an MBA with specialization in public policy and management from the University of Alberta. Paula is the implementation lead for OHS legislative reform and is coordinating the implementation of changes to the OHS code by ensuring policy intent is broadly disseminated and consistently understood by internal and external stakeholders. And then also we have helping out this afternoon is Beena Patel. She works as an occupational hygienist with specialized professional services within Alberta Occupational Health and Safety. She is a certified industrial hygienist and is a certified registered safety professional. On a day-to-day basis, Beena provides industrial hygiene supports to stakeholders, reviews acceptances and approvals, and also supported the review of the OHS code changes for Part 16, which is related to noise. So we have some very competent individuals to help us out navigating some of these changes. Before I get started as well, or turn it over to Paula, in the chat, also as part of the sign up or what you saw on the screen, we do have a link to Slido. This is where you can ask questions after the presentation. And depending on timing, we'll answer as many as we can. So with that being said, I'm going to turn it over to Paula and take it away.
Thanks, Matt. You can hear me okay? Perfect. Yeah. And I'm sharing the proper screen.
Yes, I see OHS code changes in force.
Perfect. So thank you for attending today's presentation. As Matt said, my name is Paula Elliott. I'm the implementation lead for OHS legislative reform. As a representative from the Department of Jobs, Economy and Northern Development, I'm happy to give you this presentation, which is an overview of the changes to the Occupational Health and Safety Code. So with me today is Beena. Beena, would you like to introduce yourself real quick here, please?
Yes, good afternoon, everyone. I'm Beena Patel. I am one of the occupational hygienists with specialized professional services, and I did support a large chunk of work with implementation of Part 16. Thank you. Over to you, Paula.
Great, thanks, Beena. So let's get talking about OHS code changes that are going to come into force March 31st, 2023. So I'd like to start by acknowledging the land we're on today. We respectfully acknowledge the traditional First Nations territories of Treaties 4, 5, 6, 7, and 8. We also want to acknowledge the Métis and Inuit people who share a deep history and connection with this land. We make this acknowledgement as an act of reconciliation and gratitude to those whose territory we reside on and on whose histories, languages, and cultures continue to influence our community and how we train, learn, and work. So for the agenda today, we're going to be going through 6 areas. We're going to provide some background to the OHS code over the past 2 decades. We're going to review the 5 categories of changes that occurred to the code before getting into an overview of the actual changes that occurred across 8 main topics within the OHS code. We will identify resources that have been developed or are under development to support stakeholders, as well as the implementation timeline. So finally, we're going to end with an overview of the review process and plan to updating the code moving forward. We encourage you to put questions directly into the Q&A as we go through the presentation, and we'll answer them as best we can before this meeting is done. However, if there is anything we can't answer today, we'll make sure to get back to your event organizers with a response. So the OHS code was enacted in 2003, and it consolidated 11 regulations. At the time, there was no comprehensive harmonization of language and provisions across the regulations. So that resulted in some duplication and inconsistencies. The OHS code is a large regulation with a mixture of prescriptive and performance-based requirements, which account for the majority of regulatory requirements for OHS. It was intended when the OHS code was established that it would be reviewed regularly However, the last substantive revisions occurred in 2009. In 2019, a comprehensive reform plan for OHS was approved shortly after the 2018 changes to the OHS legislation came into effect. And the intent was to update OHS requirements to enable innovation and competitiveness, as well as reduce administrative burden while improving health and safety. In December 2021, changes to the OHS Act were implemented. This included some updates to the OHS Code. So for example, flexibility for health and safety committee structure and training was added, as well as radiation protection requirements. Other changes that occurred in December 2021 included streamlining the requirements that were in the OHS regulation and incorporating them into the either OHS Act and OHS Code. So the first phase of changes to the OHS Code were announced in December 2022 and will take effect March 31st, 2023. So there were 5 key categories that the changes to the OHS Code can be grouped into. Changes were categorized either as administrative, updates to technical standards, clarifying worksite party responsibilities, removing the need for acceptances for some work practices, and changes to modernize the requirements in the OHS Code. In the next 5 slides, we're going to briefly overview these types of changes and give you a few examples from each of them. So administrative changes remove duplication within the OHS Code and they consolidate similar requirements. So a couple examples of remove duplication or consolidate requirements include in Section 12 in Part 3, it was amended to include explosives in the requirements for manufacturer specifications. That removes duplication from having that in the actual specific requirements for explosives. Explosive requirements that are currently found in Part 36 have been consolidated into Part 33, which is explosives. Similar requirements in Part 36 and 37, which is mining and oil and gas, were grouped together to remove duplication. Administrative changes also remove administrative requirements which do not add value. It corrects legal language, and it focuses on outcomes where it makes sense. As the category suggests, administrative revisions do not change the requirements, but they made up the majority of the changes that occurred across the OHS Code. As was mentioned earlier in the presentation, substantive changes to the OHS Code haven't occurred since 2009. So the reference to technical standards are either that old or older. So for example, the standard for equipment used to measure noise that's required in Part 16 for noise was updated to reference a current standard. In some areas of the OHS Code, prescriptive requirements were replaced with a reference to a standard. So one example where this occurred is also in Part 16 for noise, where the prescriptive requirements for audiometers and audiometric testing were replaced with references to technical standards. About 5 years ago, the Canadian Free Trade Agreement established a regulatory reconciliation process to help address barriers to trade that companies may experience when doing business across provincial and territorial borders. Alberta has participated in the Regulatory Reconciliation and Cooperation Table. It's called RCT for convenience, and they've participated in that process since 2017. So there have been 11 agreements across 15 work plans. Changes to the OHS Code have incorporated the endorsed agreements that harmonize standards with other jurisdictions. So for example, first aid kit requirements in Part 11, which is first aid, have been updated to reference a technical standard so that companies doing business across borders no longer have to be concerned about purchasing different kit types. Similarly, the requirements for personal protective equipment standards, so for example, fall protection, footwear, headwear, hearing protectors, and life jackets, have also been updated in the OHS Code across a number of different topics to reference the technical standard that was agreed nationally. Currently, employers can either comply with the RCT agreements or the current requirements in the OHS Code, as directors' orders were issued in the spring of 2022 to enact the agreements. As new RCT agreements are signed by the national group, consideration will be taken to incorporate those changes into the OHS Code. For the parts of the code that were updated, technical standards were updated in every area. Updates to worksite party responsibilities occurred in a number of areas across the OHS Code. The updates were designed with the goal of supporting a strong internal responsibility system. In some cases, the OHS Code may not have the correct worksite party responsible for health and safety, or it may not state who's responsible at all, so additional clarity was required. So an example of where worksite party is not stated is in Part 5 for confined spaces around testing confined space atmospheres. So wording has been amended to identify that this is an employer requirement. Another example is clarifying that both blasters and employers are responsible for the safe use of explosives. These are not shifts in responsibility, but they align with the roles and responsibilities that are defined in the OHS Act. Changes in the OHS Code under this category primarily occurred in Part 33 for explosives, but they also occurred in Part 5 for confined spaces, Part 15 for managing control of hazardous energy, Part 36 for mining, and Part 37 for oil and gas wells. The fourth category of changes to the OHS Code involve removing the need for stakeholders to submit acceptances. Acceptances are burdensome processes on both the stakeholder as well as the department, and they're only granted in conditions where equal or greater health and safety protection is occurring. So in 3 specific cases, changes were made to the OHS Code to incorporate the requirements into the legislation and remove that need for acceptances. So the first example is in Part 15 for managing the control of hazardous energy. Changes were legislated around complex group control to require the procedures to be certified as safe and appropriate for the protection of workers. Previous acceptances that were granted included a requirement for employers to submit professional engineer certification. In Part 5 for confined space, requirements for remote monitoring for confined spaces have been incorporated into the legislation. Acceptances for remote monitoring of confined spaces have been granted in this area for almost a decade. In Part 11, for first aid, hospitals, medical clinics, and physicians' offices and nursing homes have also been submitting acceptances for more than 10 years for certain medical professionals to not require first aid training. Changes to the OHS Code remove the need for medical professionals in certain settings to have first aid training in addition to the training required for their profession, which eliminates the need for them to submit an acceptance. Addressing situations where acceptances need to be granted is a priority item review for the OHS Code. As mentioned earlier, it was intended when the OHS Code was enacted that it would be updated on a regular basis. However, the last substantive revisions happened almost 14 years ago. In 2014 and 15, changes to the OHS Code were consulted on, but the changes were not enacted. Technology and work practices have evolved significantly over the past 2 decades, and OHS requirements need to keep pace with modern practices as work processes and equipment advances. One example of a change to the OHS Code that was made to modernize legislation was introducing requirements regarding autonomous equipment, so such as self-driving vehicles that are used on some work sites. Also, new requirements in Part 16 for noise were introduced to better protect workers from noise-induced hearing loss. The threshold for noise assessments has been lowered to evaluate noise before the exposure limit is exceeded. This modernizes legislation as the lower action limit for conducting a noise exposure assessment aligns Alberta's requirements with best practices and with the scientific research for the high costs of noise-induced hearing loss. So over a 5-year period between 2014 and 19, the average cost to WCB in Alberta was about $3 million per year, which doesn't include the human and social costs that are associated with occupational hearing loss. Modernizing OHS legislation also involves adopting new standards or applying requirements to industries or segments of industries that they didn't previously apply to. So for example, requirements in Part 36 for mining that previously applied only to underground coal mines will now apply to all underground mines. Currently, Alberta only has underground coal mines. However, the potential for other types of underground mines is possible, and legislation needs to be relevant to future conditions. So now we're going to get into the actual changes. There were a number of changes across the OHS Code. However, we're only able to provide the highlights of the changes across 8 core topics. In the spring of 2021, a 6-week online survey was launched to consult on 13 different parts of the OHS Code. Some of these parts were included in the changes that came into effect in December of 2021. Some of the changes are being proposed for future years, and the remaining have been grouped into these 8 topics. Of the 8 topics of changes to the OHS Code, 5 of them are applicable to all industries, while 3 of them are only applicable to specific industries and activities. So the next 8 slides will provide highlights of changes for each of these topics. So for first aid, 2 of the largest changes were made to harmonize training and first aid kit requirements. The newly referenced CSA standard Z 121017 harmonizes first aid training standards in Canada. Alberta has adopted this standard as part of an initiative to ensure consistency in first aid training across Canada. The definitions of first aid training courses are changing to align with the CSA terminology. So for example, emergency first aid and will become basic first aid. Standard first aid will become intermediate first aid, but advanced first aid will still stay the same name. But that doesn't affect work sites, as first aid training certificates will still be valid until their expiry date. Many training agencies have been including the CSA training terminology on their cards already. So Alberta also adopted CSA standard Z12-2017. So this is the first aid kits for the workplace. This was done to harmonize first aid kit content requirements in Canada. The standard provides the general requirements for workplace first aid kits, specifies a classification system for the kits, and it sets the minimum requirements for their contents based on their classification. Changes were made to Part 1, which is definitions, to align the terminology, but also in Schedule 2 to remove the previously prescriptive first aid kit contents list and update the tables with the associated terminology. A resource has been developed for stakeholders to use to compare the previous content requirements with the new requirements of the CSA standard, as a new kit does not need to be purchased. Employers can actually just add supplies to their existing kit in order to become compliant, or assemble supplies to meet the requirements. So what hasn't changed is that providing first aid services, supplies, equipment, and first aiders as required in the tables 5, 6, and 7 will still be determined by the hazard classification of the worksite, the number of workers at the worksite per shift, and the distance to a healthcare facility. Employers will need to reference the updated tables, meaning to amend their first aid kit supplies to align with the new requirements. Another key change in this area of first aid was to remove the need for regulated medical professionals to take supplementary training to comply with first aider requirements. This reduces burden on the healthcare sector and government by removing the need to issue certain types of acceptances. This change only affects hospitals, medical clinics, physicians' offices, and nursing homes as defined in the Nursing Homes Act. This is where a physician, nurse, or licensed practical nurse is always readily available. You'll actually notice in Table 7 for high hazard work, and this applies to the construction industry, nurses may still be required, and they will still require advanced first aid training, as they don't fall into one of those categories of a hospital, medical clinic, physician office, or nursing home. So finally, we've also made some administrative changes to streamline wording and improve clarity to remove duplication. In Part 15, there were a number of changes, but the impact of these changes should be quite minimal to stakeholders because the requirements have not changed. Some worksite party responsibilities were clarified to align with the Act. So for example, changing worker designated by the employer to a supervisor or worker designated by the employer. For securing hazardous energy by individual or group control, as supervisor obligations are now defined in the OHS Act. Also, the requirement for complex group control procedures to be certified by a professional engineer has been included in this part so as to remove the need for acceptances for these procedures. It's a little bit of history associated with this requirement. Historically, a statutory director had to approve the process. This approval requirement was removed in 2018 to align with changes to the OHS Act. So the default became the acceptance process where complex group control was required. However, to remove the administrative need for an acceptance, provision has been reinstated, specifying a professional engineer must certify the procedures. Professional engineer certification was usually required with the approval application anyway, so it's not really a change to the work sites where complex group control was required. We've also made a clarification on the placement of workers when pigging, and this is done to ensure that workers are safely positioned so they're not hit by the pig. This is with regards to pipelines and piping. So there's new definitions for pig catcher, and pigging, as they have also been included in Part 1, as they relate to managing the control of hazardous energy, and their technical terms for which a definition is required. Finally, other changes to Part 15 include a lot of those administrative changes to streamline wording, to improve clarity and remove duplication. In Part 16 for noise induced included updates to technical standards to the current versions and to updating terminology to align with the standards and reflect current technology. Two key requirements that have been changed in this area may require action on the part of employers. However, the updated requirements reflect best practices for health and safety. So firstly, the action limit for conducting noise exposure assessments has been reduced from 85 decibels to 82 decibels to harmonize with other Canadian jurisdictions and support prevention of noise-induced hearing loss. The reduced action limit will support prevention of workers being overexposed to noise. So secondly, there's also a new requirement for fit testing of hearing protective devices to ensure they provide the protection intended. The reference standard indicates that hearing protectors must be properly fitted, but it doesn't prescribe a method. So fit testing can be done either quantitatively or qualitatively. And I just want to note in this presentation that even though the terms quantitative and qualitative are not used in the CSA standard, the terms are objective and subjective. Quantitative and qualitative terminology is more easily understood by industry. Quantitative methods are best practices and are more accurate with evidence to show they prevent hearing loss. There's a cost associated with quantitative methods, and those costs are balanced by a higher level of protection to workers. The current provisions provide employers with the flexibility to determine which method they will use and how best to accomplish getting their workers fit tested. The quantitative method involves specialized equipment and can be purchased by employers to be done in-house. Again, this is the employer's choice as to whether or not they will do it that way. In this part, clarification regarding to the competency of persons conducting noise assessments has been made. Employers must ensure that a noise exposure assessment is conducted and interpreted by a competent person. So this is already an existing requirement, who is trained in conducting noise exposure assessments, is trained in the calibration, operation, and maintenance of the equipment used in conducting noise exposure assessments, and can demonstrate an understanding of the method used for measurements. So these are new qualification requirements. Noise exposure assessments are already required to be done by a competent person. So competency is being defined in the OHS Act. However, the additional prescription provides clarity around what competencies the person should have. We'll note that the changes in this area do not require the person has to take a particular course or certification, though competent persons conducting noise exposure assessments in the past may have taken courses to help them become competent in the first place. Other changes in Part 16 for noise include streamlined requirements for audiometric testing through the introduction of a technical standard to replace prescriptive requirements. In Part 1740, overhead power lines and electrical utility workers. So the changes that were made to these parts were either administrative or made to update technical standards. So the reference technical standard for electric utility safety was updated to a CAN ULC S80114. This is a standard on electric utility workplace electrical safety for generation, transmission, and distribution. So the purpose of the standard is to provide safety performance requirements for electric utilities, workers, and employers involved in work on or near electric generation, transmission, and distribution systems. So this is not necessarily for the general public. The limits of approach that are identified in the schedules have been maintained. There's also clarification of wording to remove some duplication. So for example, who must be contacted when working around overhead power lines, as well as Part 17 now omits the word energized when describing overhead power lines, as all overhead power lines must be assumed to be energized. There's a responsibility of worksite parties has been amended to ensure the safe limit of approach distances are maintained. And then we've made updates to Part 40 to align with the changes in Part 17 to reference the updated standard. A number of changes were made across several areas, and we've already mentioned a couple of these. So we grouped them into one core category called miscellaneous changes. So in definitions, which is Part 1, there were almost 90 definitions that were either amended, removed, or added to align with changes that occurred across the code. So the full list of changes to the definitions can be found in the amendment regulation. In Part 3, I already mentioned that Section 12 was amended to include explosives within the requirements for manufacturer specifications. Part 5, confined spaces, there's an introduction of a new option for the use of remote confined space monitoring systems to remove the need for acceptances. Part 6 for cranes, hoists, and lifting devices, as well as Part 23, which relates to scaffolds and temporary work platforms. There was a change in these areas to actually change the frequency of inspection from daily to reasonably practicable to provide flexibility and to address the realities of the work site. Parts 9, 18, 39, and 41. This is one of those updates to technical standards for the PPE that was mentioned earlier to align with harmonization of technical standards per that RCT agreement. Part 25 had a minor update regarding contact by clothing. Wording was revised to add personal protective equipment and any other thing that may cause a hazard to workers to align with the intent of the provision, which is to prevent anything the worker's wearing from being caught and creating a hazard. This change was actually made to enable removing duplication in Part 37 for oil and gas. Part 32 had a minor change. It removed the word open from open pit mine in all instances to align with the definition of pit. In Part 33, there were updates to technical standards to reflect current technologies and best practices for health and safety. It's also a consolidation of requirements for blasters permits or blaster certificates, so for both mining and non-mining, to remove duplication from both of the single streams. It's a consolidation of requirements from Part 36 into Part 33. Some of the requirements are new to non-mining employers who use explosives, but they're designed to standardize practices across industries and improve worker health and safety. So some of those examples of that streamlining are inventory control, safe transportation, safe storage, controlling access, protection of explosives from weather conditions and water damage, limiting quantities, precautions to prevent unintended detonation, protection of workers around blasting areas, precautions around misfires, and requirements when conducting secondary blasting. In Part 36, we updated technical standards to reflect current technologies, we reorganized provisions to provide greater clarity, and we consolidated requirements for underground mining to streamline administrative requirements. So for example, removing the need for government approvals for equipment and work process, which aren't required in other hazardous industries. There's also an expansion of underground coal mine requirements to all underground mining to future-proof health and safety provisions should other underground mines be developed. There's a provision of flexibility for sand and gravel pits to reflect the realities of their operations, but only for emergency response teams, mine walls, and some requirements for mine equipment. In Part 37, several new requirements were added for oil and gas well sites to improve health and safety. So for example, there's new requirements for worksite health and worksite specific health and safety orientation. There's a new requirement to ensure safe organization and layout of the worksite. There's a requirement for suppliers to keep and share records for rented or leased equipment with employers. There's new requirement for the development of procedures when flammable products are used to purge lines. There's a new requirement for ensuring sufficient quantities of firefighting equipment are provided at the worksite. And a new requirement to ensure safety when raising and lowering masts on derricks. We also made some updates to technical standards to reflect current technologies and best practices for health and safety. So I just want to make a note about ticketable provisions. Ticketable provisions for occupational health and safety legislation violations were introduced in Alberta in 2013, along with administrative penalties. They must be prescriptive and they're limited to specific situations where a worksite party did not do something that they were required to do. So this change actually only occurred in Part 33, 36, and 37, which is explosives, mining, and oil and gas. And it changed 6 ticketable provisions into performance-based requirements with the amendments. So the provisions were no longer suitable for ticketing. Of those 6, 5 relate to ignition sources near explosives, and 1 relates to record keeping. No tickets were actually ever issued in these provisions anyway. So a note about resources that are available. On December 15th, when the announcement was made that the OHS code had been changed and will take effect in March 31st, there were 6 bulletins that were published to go along with those changes. So those changes are for all of those areas with the exception of Part 33 for mining or explosives and Part 36 for mining, which are still under development. Also, a number of core bulletins that related to both first aid and noise are being reviewed and will be published in time for the enforced changes. As normal, when employers have questions about changes to either the OHS legislation or just interpretation changes, information about the legislation, there's a number of areas you can go to. So we have our publication store where we posted our new legislation bulletins, and we'll be posting more information on that. We also have the OHS Code Review website, which is the area where it identifies the upcoming code review parts that we'll be looking at. And we have an OHS Code Review email that you can actually email specific questions to. As always, we also have our OHS Contact Center where the information is there on the slide. In terms of upcoming resources, we have the amendment regulation that actually was posted in December 15th. That's the ministerial order with the actual changes to the OHS code. We have 2 bulletins that I mentioned that are still under development because of the technical nature of them. They've taken quite a bit longer to ensure that they're easy to understand for employers. The consolidated legislation, which is the current version with the amendment regulation, should be available towards late March of this month. The OHS handbooks can be pre-ordered from the King's printer, but they're not going to be available probably until a little bit closer into the enforced date, and then just more presentations that we're doing. So in terms of the implementation, the legislation will come into force on March 31st when the new provisions will be in force. Typically, transition periods vary. However, the number of changes that we've mentioned throughout this presentation should be relatively simple to implement for employers. This is a little bit different than the changes to the OHS Act, where there were significant overarching changes to things like health and safety committees that required a little bit longer implementation time. So as we develop more additional resources will be built. So let's talk a little bit about the OHS Code Review Plan. So this is a 6-step typical policy cycle. So we start off with a call for topics for review, consider stakeholder feedback, consider some of those harmonization priorities, evolving issues, research, compliance, and enforcement data. Then we prioritize topics and publish a 3-year review. Get into phase 2, which is the technical analysis and initial drafting of the changes. Phase 3 is the public consultation, where we typically do an online survey. Phase 4 is the government approval for proposed OHS code changes, and that's actually when we publish with an in-force date and an announcement. So we're actually in 2 different stages here. We're in stage 1 and stage 5. So in the implementation stage, worksite parties are expected to be in compliance with the requirements on the in-force date. The updated OHS code resources, so we mentioned the bulletins, the web content, and the e-news, will support understanding of the changes. But we also provide things like presentations and webinars to support stakeholder and outreach on changes as needed. So in terms of the evaluation, which is our kind of last step, if this is done correctly, this can actually provide valuable feedback on the changes that we've implemented that may actually need to be reviewed again. So this is the evaluation stage where we typically start asking, how can the OHS code improve health and safety outcomes for Alberta workplaces? But we also ask, how can the OHS code review process improve? So stakeholders can play a vital role in this area by helping gather information about the changes when we send out requests for information. In terms of priority review, I mentioned a number of times throughout the presentation that these particular types of things will actually be priority items for review. So these are the categories that will be for OHS topics that will be included in every year of changes. So that's the issued allowances, approvals, acceptances, and recognitions, OHS recommendations from public vitality inquiries, if there are any, current work plan items under that Canadian Free Trade Agreement or that RCT, and then correction of errors and modernizing language. So with that, we have our published updated 3-year code review plan. You'll note on here that it looks like there's an increasing number of topics the kind of farther away we get from this year. That's only slightly true. The indication of where we have for each of these parts, it doesn't necessarily mean that the changes will occur in those years or that the work will be completed in those years, but that's when the work will be commenced. And so we are looking at 4 different topics this year, and we've doubled that for the following year. However, there's some pre-work in some of those topics that will actually follow through into subsequent years. So as a reminder, priorities for proposed change in regulation are informed by government mandates and minister direction in addition to health and safety priorities. So we developed the proposal for changes to the laws. That's the ministry staff. In the case of the OHS Code review, that's the research, engaging with technical working groups, consultation results, legal review, and analysis by staff. Proposals for changes move forward to government committees based on the type of policy or legislation. In the case of the OHS Code review, it's the Economy and Affordability Committee. They review the proposal, and then if needed, they flag concerns to be addressed before the proposal goes to cabinet. So unlike the OHS Act, changes to the code don't get approval as a bill in the legislature. Cabinet actually reviews the proposal and provides policy approval, but then the Legislative Review Committee actually needs to provide approval of the actual changes to the wording. So there can sometimes be a little bit of back and forth between these committees to address issues. Once the Legislative Review Committee approves the changes, then the ministerial order can be made and signed off and regulation filed with the King's printer. So in terms of the certifying partner role, this presentation is being provided across a number of different groups. So we're asking certifying partners and their members to continue to share the resources, to update any training as required, survey and compile feedback about legislative changes. So that's that evaluation stage that when we're looking for information about the effectiveness of how well we gave the information and how well it worked. And then to engage in the consultation for future phases of legislation changes. And with that, I'd like to say thank you, and I'd be happy to take any questions.
Thank you very much, Paula. I think, yeah, there's a number of questions that are coming through through Slido right now. So this is fantastic. And then this also gives folks the ability to upvote. So then we make sure that we tackle the high priority questions accordingly. So Beena, I think you mentioned you do have access to the questions. So unless you want me to share them on my screen, or you just want to read them out between yourself and Paula, I'll leave that up to you on how you want to tackle them.
Sure. Why don't you start reading them out? I will be able to answer all noise-related questions. There are a few which are not noise-related. Let's see if Paula is able to answer them, and we can team tag.
Okay, I can.
It's a test.
Okay, I'll read them out, but if you want me to share my screen, I can if you need me to. So
you know what? That's probably a good idea. Then everyone can see the question.
Excellent. All right. Okay. Let's go. Are you able to see that okay? I can zoom in a little bit if you'd like.
Oh, that's perfect.
Okay. So once the question's read, I think Rochelle will take care of clearing that question, and then we can just move on to the next one.
Sure.
So I'll leave that with you to read the question and answer accordingly.
Do you want to go by topic?
Let's start with the high priority, because there's 30. Like, these are the high priority ones. The ones that are at the top. This one had 31 votes, I guess, to up the priority. So I think maybe we'll start with those ones.
Okay. So the question is: are the disposable earplugs still an option, or fit testing must be implemented?
Yes, so disposable earplugs are still an option, and yes, they would require fit testing, fitting as recommended by the manufacturer.
Yeah, and I think there's a little bit of kind of clarification on this one here too. So the CSA standard for fit testing is actually, it does actually indicate that the requirement for fit testing insertable hearing protection devices, as well as ear muffs. And so this is where there's that two different methods for doing that, but the design is for the insertable type ear hearing protection. Okay, so can you explain how the changes to first aid supplies will provide better care for workers? I'm not sure that the changes actually were about better care for workers. If you look at the content comparison, they're very similar. There's some minor changes in terms to the sizes, as well as to some of the quantities, just based on the CSA standard. They basically kind of took and aligned requirements that were for best practices. So that's where CSA standards are usually developed by a group of professionals, a number of different technical working groups, And that's kind of where that comes into place. So this isn't an agreement that is made lightly. This was actually an agreement that was signed across Canada to subscribe to that CSA standard for first aid kit supplies. Typically, each province would identify their own individual supplies, and then actually, they're very similar to what's in the CSA standard. The bulletin for Part 11 actually does have comparison tables. So you can actually see there's a couple of other items that are required in the CSA standard that weren't previously required, things like individual use antibiotic ointment and tweezers. So a couple of additional pieces there. So I encourage you to compare the requirements and make sure that you've got the additional things in there before March 31st. Another first aid one. So is there a grace period for having a CSA compliant first aid kit? There's significant supply issues and orders may not arrive in time for the new legislation. So we actually designed that bulletin with the comparison tables to be able to easily show to employers, here's the small differences between the kits. So there's no mandated requirement that an entirely new kit needs to be purchased. You can actually assemble the individual supplies as well as assemble the supplies to build your own first aid kit, put it in a container that kind of meets the requirements of that. I have heard questions about suppliers not being aware of these changes. This agreement that was signed as part of that RCT harmonization was actually signed in 2018. And so we actually issued a director's order to allow CSA compliant kits to align with that agreement. We did that last April of 2022. So the suggestion that suppliers aren't aware or haven't been made aware over the last 5 years was a little surprising. I have been able to find CSA compliant first aid kits online, and I haven't met any indication that there's any supply issues from any of those vendors. CSA kits, the next question here. CSA kits require tourniquets, yet non-advanced first aid does not include training on this. How are employers to handle the misuse of these with first aiders? So the first thing actually, and this is another question. Oh, we went down. Matt, is this a voting thing?
They can be
where they do
upvoted,
actually
yeah.
change? Okay.
Yeah.
So I think I got the grace period one. Okay, perfect. So okay, then I'll go to the guidance on approved qualitative testing methods for hearing protection, fit testing. Dina, that's off to you.
Yeah, so for qualitative testing methods for hearing protection, highly encourage everyone to reflect to the manufacturer specification for the particular hearing protection that they are offering at the work site.
Yeah, and we do actually have kind of a tips thing in that bulletin that we developed for the changes in Part 16 to noise to actually have some tips, but manufacturer instructions are actually suggested in there as well. Okay, so CSA kits requiring tourniquets, yet non-advanced first aid does not include training on this. So the CSA standard for training does actually require training on severe bleeds and hemorrhage control. And so I've heard from a number of people who have taken first aid recently that does actually specifically include tourniquets. However, if additional supplies is required in a first aid kit and a first aider is not trained to use that, it's actually the employer's responsibility to ensure that workers or first aiders receive training in it. So this is to ensure that workers are confident in using the equipment and supplies as part of the OHS Act requirements.
Okay, I'll take the next question, Paula. How does a company determine if they need a noise survey? So this goes back to the employer and them having to perform their hazard assessment. If the employer determines based on the hazards at the work site, they're finding that noise is a concern. If hearing at a short distance is a concern, if it is very difficult for workers to hear each other or due to the processes, they are required to conduct a noise survey. Okay, I'll take the next one as well. Does hearing protection fit testing require a training card now? So the CSA standard does not mention a requirement about a fit test card. However, employers will be required to prove that that has taken place. So they can demonstrate that by either showing training records, they could use fit test cards, any other means. So there's quite a bit of flexibility to prove that they have been fit tested.
And I just want to kind of note on that too, that there's no actual requirement for respirator fit testing cards either. And so it's a convenience to a worker to be able to have it or to an employer to be able to provide it. But there's no legislative or legal requirement for fit test cards to be produced. It just happens to be that that's the common method that most service providers or employers will do.
Yeah, I'll take the next question. What is the frequency of hearing protection fit testing? The reference CSA standard does recommend a fit testing frequency of every 2 years, but they would be needed to be done sooner if there's changing equipment, changing conditions of the anatomy of a ear of somebody, and all those other conditions.
Yep. Okay, so where or when can we purchase a new hard copy of the OHS legislation? Those copies of the blue books, the handbook for the legislation, are purchased through the King's printer. And so they do actually have them up and available. Last time I checked was on Monday, that you can actually purchase them, and they are producing them. Okay, so the next question is, CSA first aid training accepted across provincial lines? So for example, if a worker comes from Saskatchewan to Alberta, is there CSA first aid training obtained in Saskatchewan accepted in Alberta? So I'm actually going to answer that one first. And essentially what that is so the training organization actually needs to be approved by a director first in order to be able to provide first aid. They need to be approved in Alberta. Many first aid training organizations are approved in multiple provinces. And so if a worker comes from Saskatchewan to Alberta and they took it at an organization that's approved in both Alberta and Saskatchewan, then yes, their CSA first aid training will be valid, provided that the training certificate has not expired. And so we have a listing of approved first aid training organizations that do provide it, and then we mandate that they actually do that across the CSA standards.
I can take the next one, Paula.
Sure.
Who offers training to conduct noise assessments in Alberta? So there is no specific requirement for certification or defined training in OHS code. However, the OHS code is very clear about competency demonstrated during conducting noise exposure assessment. So we have clarified requirements for anyone who is performing noise exposure assessments. They need to understand and be able to calibrate the equipment they're using. They need to understand how the equipment operates, how the equipment is maintained and used, and they also need to be should be able to demonstrate how this equipment works. So that's the requirement for competency around noise exposure assessments.
Thanks, Beta. Oh, thanks, Matt. I'm going to go back to so the CSA standards now. The CSA standards now referenced in the OHS code be provided free of charge. So historically in the past, CSA standards that are referenced are actually accessible through a free account through CSA Community. And so by signing up for a free account, you can actually access the CSA standards. There are other standards that are referenced in the code that are for purchase. They will also be for purchase with the updates as well. That's not a change from what the existing requirements are. Okay, so the new items do not fit in the old first aid kits. How do we manage the additions? There are different size requirements and different, I guess, quantity requirements. You may actually have additional supplies. The manufacturers are the ones who actually make the first aid kits. So the requirements in the CSA standard for first aid kits indicates that the kit, so you could actually assemble contents in a separate kit to supplement that additional, kind of first aid kit, and mark it as first aid, provided that it's portable and it does, actually kind of have a material that will protect the contents in the kit. And so that kind of answers that that second question as well that was just up there. So the move to CSA standard for first aid kits. So we wanted to be able to provide a simple method for employers to recognize what additional items were needed. And so having a secondary kit, there are requirements around the container the contents are in, but that doesn't necessarily mean that they all have to be in one container. So having an additional kit, provided that it's marked with first aid, and in that accessible area of the other one should be sufficient. Bina, do you want to take the next one, or do you want me to take that one? About foam earplugs?
Sure. So foam earplugs don't have manufacturer guidelines for fit testing as they expand to fit your ears, but fit testing on those was mentioned. Why and how we do this. So the idea about this is to ensure that you get a better seal when you're wearing this hearing protection device, and it gives you effective protection. The most common practice out is these are offered to workers. The workers don't know how to insert them nicely, and it defeats the purpose of wearing them. Hence the idea of requiring fitting. Paula, you could add.
Yeah, so I just want to kind of clarify. So it's manufacturer specifications for proper insertion. And so I can guarantee you that they are with the foam earplugs. They might just be on the box rather than on the plastic container of the individual things. And so the intent is to ensure that the worker is properly inserting the foam earplugs into the ear. And so again, that publication we have has tips. If they're sticking up out of the ear, they're not inserted properly. And a fit test is designed to ensure that that insertable earplug is actually inserted correctly per the manufacturer specifications to provide the protection that's intended. If they're not inserted correctly, then they don't actually provide the protection intended. So I can certainly confirm that the manufacturer specifications are in there about proper insertion, which is a fit form of a fit test, just a qualitative fit test.
I'll take the next question. Is a new noise exposure assessment required with this new threshold for noise? We are primarily an office environment consulting with some construction. So going back to the basics, employers will require to conduct a hazard assessment for their work site. If there has been any changes to the work site in the work area, physical alteration, renovations, repair, which changes the way things are in the workplace, a noise assessment would be required. And yes, beginning March 31st, a noise assessment would be required if 82 dBA noise is taught at the work site.
I think I kind of had this conversation with one of the other, a different employer, where if you're in an office environment and you're being constantly exposed to a fire alarm, then probably you should do a noise exposure assessment. But that doesn't meet the requirements of, being possibly exposed to noise in excess of 80, 85 or 82 in this case. So depending on the worksite environment, there are activities that do typically create higher levels of sound. An office environment wouldn't necessarily realistically be one of those. Okay, so I'm going to take the next one. How do we keep up with the changes in the OHS books? I had clients buying books after December 1st. It's not feasible to ask them to keep buying new. I don't disagree with that. In fact, there's no actual requirement to have a physical copy of the handbook online. The OHS Act actually indicates that it needs to be accessible. And so electronic versions of the changes to the OHS code have been available since December 15th. And so there's nothing in there that indicates that it needs to be a physical copy. Okay, so we have another question here, Bina, that might be for you.
Yeah.
I think this is a little bit more of kind of a work site specific question. So how do you get a good seal for hearing protection for earmuffs while wearing safety glasses?
So this comes back to how you assess your compatibility of personal protective equipment, which means, yes, if you are wearing a earmuff, you have glasses, definitely there is a potential for you to not get the appropriate seal, and hence the idea of fit testing. But there are, if you try to achieve the seal, that's good. If not, then you should always resort to your other controls, such as controlling the noise at the source, or keeping that distance away from the source of the noise, or making sure you reduce your exposure time and things like that. So that's also other options to be considered if you're not achieving that appropriate seal.
Okay, thank you. I'm going to tackle a couple of these questions because they relate to the schedules. I'm going to tackle them together, as well as kind of a value question that's in here. So will code table 7 be aligned with the CSA standard? Is it available? So that is available through the amendment regulation. The table has been updated with the new terminology. There is a slight change in high hazard work, where previously some smaller employers, regardless of how close you were to a healthcare facility, could have actually had a number 2 kit that will now be required to have a number 3 kit. There are comparison tables to show you the different quantities that are required from that change and the additional amounts that are in there. In terms of there's a second one on the screen there. Will tables 2 and 3 be replaced? So this is about hearing protection selection and background noise during testing. So those have actually both been repealed because they're covered by CSA standards in the actual referenced in part 16. Was there an actual incident to prompt the change to first aid supplies in Alberta? So can you please share? So not that I'm aware of. Again, so the RCT agreement is part of that Canadian Free Trade Agreement that was established to address barriers to business, barriers that companies have doing business across borders. And so having BC first aid kit content requirements and Alberta first aid kit content requirements that didn't actually line up required employers to actually have more supplies in their kits that actually was compliant with both provinces. So by aligning with the CSA standard, this now actually means that you can actually go from BC to Ontario with one first aid kit that is compliant across all borders. This is the other change I was just going to kind of gather with all these upcoming changes. Is buying a physical copy of the new OHS book worth it? That's entirely an organization choice as to whether or not they want to purchase the physical copy or not. Okay, what can Alberta employers do if we disagree with the changes? So we do actually have that labor.ohs review at gov.ab.ca email that you can actually send requests and suggestions for changes to the OHS code. In terms of disagreement, the changes will come into effect on March 31st, 2023. But if you do actually have rationale and supporting information for why you think it should change, provide it to that email address, and that actually becomes part of the consultation process, is to actually take feedback and actually look at it in addition to the other research that's actually done.
I'll take the next one, Paula.
Sure. Yeah.
Is your employee, if your employee decides to wear hearing protection but is not mandated by the company, would fit testing be required? So this again boils down to the hazard assessment performed by the employer. A selection of any personal PPE is based on a hazard that exists at the worksite. However, if voluntary use occurs for a particular PPE, the employer is now liable to ensure that the PPE is not causing undue risk to the worker. So from an OHS standpoint of view, yes, we would require fit testing for that particular PPE.
Do you want to take the next one too, Bena?
Yes. Do employers have to train people, have someone competent on how to qualitative and quantitatively fit test workers to hearing protection? So the employer can make a determination if they have competent staff within their organization who could do this job, that would be wonderful. If not, they could also retain a service provider to provide these services for them.
Okay, thanks, Mina. I'm going to take a couple more, and I've got another meeting that's going to start right now, so it's okay being a few minutes late. But I wanted to actually just get the complex group control procedures, because we haven't had a Part 15 question yet. So the descriptions of complex are subject to interpretation. When would we require sign off by an engineer? And so when the requirements of either individual control or group control are insufficient in protecting workers, that because of all of those different requirements, that's where complex group control procedures would be required. The clarification on which type of first aid kit is needed. So the schedule actually has been updated, and so it does actually have the requirements of the first aid kits in there. So the amendment regulation actually does have that. The consolidated version will be available probably next week or the week after, be posted on the King's Printer. So I encourage Matt for you to just kind of keep checking on that for news. Conversely, if you subscribe to the e-news will actually have an update on there as well. So they'll actually post a link to say, hey, the consolidated version is available. Please visit the King's Printer for that. So and I think that that's all the time that we have for questions.
There was a lot of questions, and you were able to provide a lot of answers.
We tried to go through a lot of them. Yeah.
Really appreciate the time and the commitment that you that both of you have made for this. The nice thing is that we are able to track all these questions that have been answered, as well as the ones that have not been answered. So there might be some opportunities for us to submit those over to you as well, and maybe there's something that we can do to try and answer those and post them at a later time. We'll take those back, and that's the nice thing about kind of the way we did it, so we can track that a little bit more. Just before we sign off here, for those that are still logged into Slido, there is a post webinar poll. I encourage everybody to please take it. It's super important to the ACSA to make sure that the topics that we have, not only today but in the future, we take that back so that we can keep having webinars like this or info sessions like this that seems to hit everybody in some manner, shape, or form. So that being said, I will
the one suggestion I'm just going to make is I mentioned a couple of times, like the bulletins that we've provided. Really go through those. Those probably answer a majority of the questions that have actually either been asked or probably that you have on your list. And so share those with your members, make sure that they have a chance to go through that, because that might actually change the type of question that they're asking, because we actually have tried to address a good chunk of those in there.
Yeah, I think you and I had a conversation about this, but the noise, the noise assessments and the noise information in those references or resources and bulletins, they did answer quite a few questions as well. So that was really, really good.
Great.
All right. Well, thank you very much to you two. We appreciate it. And thank you everyone again for being able to attend. And hopefully everyone has a fantastic afternoon and a safe day.
Okay. Thanks very much. Thanks everyone. Thanks, Matt.